Cone biopsy. What microscopic changes do pathologists look for? Imagine a tiny sample of tissue from the cervix being examined under a microscope, revealing a lot about what's happening inside. When doctors perform a cone biopsy, they remove a cone-shaped piece of tissue from the cervix to check for abnormal cells. Pathologists then carefully study this tissue to find clues about early signs of cervical cancer or precancerous changes. They look for specific microscopic features that tell them how severe the abnormality is and whether it might progress if left untreated. One of the main things they assess is called cervical intraepithelial neoplasia, or CIN. This is a way to classify abnormal cell growth in the cervix. CIN is graded from 1 to 3. CIN 1 shows mild changes where abnormal cells are only in the lower third of the cervical lining. These cells look slightly different but often go back to normal on their own. CIN 2 involves more abnormal cells extending into the middle third of the tissue, which means there's a higher chance of progression, so treatment is usually recommended. CIN 3 is the most serious, with abnormal cells occupying most of the thickness of the epithelium. This stage is called severe dysplasia or carcinoma in situ, indicating a high risk of developing into invasive cancer if not treated. Pathologists also examine the cellular features closely. They look for loss of normal maturation, which means the cells don't mature properly as they move from the base to the surface. Normally, cells mature in an organized way, but in abnormal tissue, this order is disrupted. They also check for disorganization and loss of cell polarity, where cells lose their normal orientation. The nuclei of these cells often appear enlarged, irregularly shaped, and darker than usual, a sign called nuclear atypia. There may be increased cell division or mitotic activity, especially in the upper layers, which is unusual in healthy tissue. Additionally, they look for koilocytes, which are cells with a characteristic appearance caused by human papillomavirus infection, showing enlarged nuclei with clear areas around them. Another critical aspect is how far the abnormal cells have spread. Pathologists assess whether these cells are confined to the surface or have extended deeper into the tissue. They pay special attention to the squamocolumnar junction, the area where the outer squamous cells meet the glandular cells, because this is a common site for cervical cancer development. If abnormal cells have invaded beyond the epithelium into the underlying tissue, it indicates invasive cancer, which requires more aggressive treatment. The edges of the tissue sample, called margins, are also examined carefully. If abnormal cells are present at the margins, it suggests that some abnormal tissue may still be inside the cervix, meaning further treatment might be necessary. Conversely, clear margins indicate that the abnormal area has likely been fully removed. Lastly, pathologists note other features like inflammation or reactive changes that might be present due to infection or irritation. If invasive carcinoma is detected, this significantly influences the next steps in treatment and management. In summary, when a pathologist examines a cone biopsy specimen, they look for signs of precancerous changes, such as CIN grades, cellular abnormalities related to HPV infection, the extent of abnormal cell spread, and whether invasive cancer is present. This detailed microscopic analysis helps guide doctors in deciding the best course of action, whether it's further treatment or close monitoring. It's a vital part of cervical cancer prevention and early detection, ensuring women receive the most appropriate care based on precise, scientific evaluation. Always remember, for any concerns or diagnosis, consulting a healthcare professional is essential to get personalized advice and support.